Improving hospitality in hospitals. So we have those stakeholders, which are the patients, nurses, doctors, investors, non-governmental hospitals, government organization, insurance providers. And then we move on to the first step or phase of the journey map when it comes to visiting a hospital. So at this time, the person might walk in to urgent care, the ER, or just a hospital, and they will need some type of information based on what they need. Patients often go to seek diagnosis and then they need a treatment that follows that. And they need to go get checked. They might need a specific doctor depending on the illness they have. And some patients will search online. The thing is, they will encounter incorrect information or confusion. So the hospital should be more clear when it comes to that. The second step of the journey mapping is seeking treatment. So the person in the ER might get care there, and the person just walking into hospital might be referred to specific doctor depending on the issue. The process is often overwhelming, and patients might need a specific specialist. And the step is also confusing, not knowing who the best doctor is, who's available, who's highly rated, who's recommended. Um, yeah.
And because here it comes to the problems associated with the pre-treatment. There are several problems. So first, the patient often face a long and inefficient process just to update their information. It can take over 15 minutes just to fill out the survey, and it's often got worsened by language barriers, especially for non-English speakers. Second, insurance authorization is a big pain point because manual processing causes delay in care and sometimes up to 10 days just to get the insurance authorized. And finally, patients often wait alone in quiet, cold waiting rooms, which definitely induces anxiety and stress for the patient right before they get seen by the physician. And for treatment, this experience continues to be tough for patients. The transition to the exam room is often cold and impersonal, which makes the process feel mechanical. Then the doctor-patient interaction can be really rushed. Patients often leave feeling confused or like they weren't heard at all. And finally, the discharge process is really fragmented because there's no clear communication. Patient walks out with unanswered questions and not knowing what to do next.
After treatment, we have follow-ups, and this includes scheduling follow-up appointments. These are often missed due to patient perceptions of it being unimportant. And we have test results, uh, which are usually have long wait times, and there's often confusion on the patient's part about interpreting these results. And adjusting treatment plans, there's ineffective communication leading to poor adjustment procedures. Next, we have feedback, and these often have low response rates due to patients feeling like it's unimportant because it's being ignored. And there's a lack of transparency. This is where patients are unaware whether if the feedback was taken into consideration. And there's ineffective use of feedback. Hospitals often don't take actionable steps in addressing feedback.
Okay, so now we looked at all the problems. We can move on to seeing how we can improve each of the problems associated with each journey phases for patients. So the first one is identification of issue and treatment.
So when the patient goes and gets some form of treatment or needs to find a specific doctor, they often don't know who to go to. So I would say have a person in the front desk who guides them. Also, hospital layouts can often be confusing. So it's important to have someone who really guides people or patients once they're in the hospital. And sometimes the patients that don't go to the hospital and they search online, they don't know where to like really find the information. So for that, a good website is needed, like the example shown right here. It just shows like referrals to different doctors in specific fields and yeah, who's better, who isn't.
To improve the pre-treatment, we can make three key changes. The first one is we can use the pre-populated digital checking system and offer digital surveys in different languages to eliminate the language barrier and also speed up the checking process. To speed up the insurance authorization process, we could use some online portals or implement electronic authorization tools to show the real-time progress of the insurance authorization. Lastly, we could offer water, smooth lighting, light music, and comfortable seating area, or even children playing area in the waiting room for patients to relax. And we could also put a digital notification board showing the approximate wait time for patients to see. When it comes to treatment, um, I think human connection is the key to improving this. So we could have medical assistant as staff to introduce themselves and explain what's coming next during the transition to the exam room. When it comes to doctor-patient interactions, doctors should greet patients by name, providing enough eye contacts and clearly communicate the treatment plan and next steps. At the discharge process, a staff member, medical assistant, should work the patient through what happened and what comes next, supported by a printed handout. All these small changes can make patients feel respected, informed, and safe because they know what's coming next.
To improve the follow-ups phase, doctors can communicate the symptoms the patient should be looking for, and this will help with adjusting treatment plans later. To improve test results, we could automate the sending of these results and include adequate interpretation of results that's easier for the patient to understand. For adjusting treatment plans, as mentioned earlier, we can even quote patient input and specify changes made to treatment plans. For improving the feedback phase, to improve the low response rates, we can make patients aware of the feedback being taken into consideration. To address the lack of transparency, we can require doctors to respond to feedback. And to improve ineffective use of feedback, we can require hospitals to publicly report feedback, which will make hospitals incentivized to improve. Thank you.
Yeah, that's it. Thank you very much for listening.